Panel here to talk about. My name is Jeffrey Campos. I'm the president and CEO of the Southwest Valley Chamber of Commerce. And today we'll be talking about some alternatives to healthcare or some healthcare solutions that are out in the marketplace now. So let me begin with starting with what we'll do is we'll do a little session. I have each one of you individually talk for about 5 minutes on who you are, your company, and then we'll go into some specifics on the perspectives that are out there today in healthcare. So let's start with Ralph. Ralph Armijo, welcome.
Great. Thanks, Jeff. Thanks, everyone. Look forward to being a part of this this panel discussion. Again, my name is Ralph Armijo, and I am the president and CEO and founder of Innovative Health Holding. And what's probably something you should understand right up front is that as the president and founder of a healthcare company, and actually a healthcare insurance company, my background is not in healthcare. I'm 18 years in corporate America and another 28 years as a serial entrepreneur. So I bring to the table a very different perspective. I have been immersed in healthcare for the last 6 years, and I spent more than the last 3 years, 3.5 years, of building out the solution that we are bringing to market today. Again, what I think I bring to the table is a couple of things. My entrepreneurial, this is my 5th startup company, and I have been involved in creating other companies that have solved major industry problems, including e-commerce and cybersecurity, things of that nature. So healthcare is my greatest challenge of all the things that I've done in the past. But I come to the table as a user. I come to the table as a business person. I come to the table really with just mixed experiences in the healthcare industry, which is what really started my motivation. And that is all the way from great personal experiences to catastrophic experiences that I've been involved with family members. So just like all of you, we have different levels of experience. And what I have found is that, business or healthcare is very complex and it's very personal. And so what I've done to try to build a solution here is to bring people with varied backgrounds. And the top 5 senior people in our leadership team represent over 115 years of experience in entrepreneurship, healthcare, and insurance, and medical management as well. So our whole objective here is to make a difference in healthcare and to really change the paradigm and provide disruptive solutions to the marketplace. So specifically what we do is we are a technology company that's leveraging the technology to revamp healthcare. And we have integrated technology, which makes it easier to use and very scalable, and our personalized advocacy, which is really what our version of advocacy is. It's really medical management. So every member will be assigned an advocate, which will be their first point of contact. And that person will be a medical person, either a nurse or a mid-level, to help support the advocacy as well as the care management side. And then the third part of that is we own our own insurance, a captive insurance company. And that's a place where our employers can actually, hopefully we're driving claims dollars down. The insurance company is a repository for the unused claims dollars, and the employers participate back in the unused claims dollars. So at the end of the day, we've integrated technology, personalized advocacy, and our own captive insurance company to offer a solution which we call Peace Plan. And that is a self-funded, employer-sponsored healthcare benefit plan. And we have 6 plans within that. We try to keep it simple. And our focus is on small to mid-sized companies. And initially, we are an early stage company. We'll be launching full service. We'll be able to start quoting now in this month of November, and we'll be able to deliver in February. So we are market ready. And our focus is the small to mid-sized companies. Today, our smallest employer is 50 employees. Our vision is to really drive that down to 2 over time, but that's a different challenge. So it's 50, and we can do as many as 10,000. So the top end is not a matter, but we do believe that the small business is the underserved market where they pay the most and get the least amount of services. Our mandate is to lower the overall cost by up to 40% and to provide better quality healthcare to the employees and to their families. And at the same time, we will be taking 10% of our net profits and putting it into a foundation to give back to the communities that we serve. So that's our business. That's health, innovative health. There's 2 companies underneath that, but our product that we'll be bringing into market is Peace Plan Health.
Great. Thank you, Ralph. That was very good. Thanks. Next, we're going to have Melissa Blatt of Indie Pop. Love that name.
Thank you. Thank you. Hi, everyone. I'm Melissa Blatt, founder and CEO of Indie Pop. Indie Pop stands for Independent Population. And those are all the solopreneurs, freelancers, gig workers, small business owners that basically are not getting their healthcare from a company. And I am a member of my own health share. I left the corporate world in about 2018, and I was in my late 40s, and I had sticker shock when I was presented with the COBRA plan. This was kind of the first time I was on my own for healthcare, and I realized I really wasn't alone. There is 57 million in this population that struggle just like me. It makes up about 35% of the workforce, believe it or not. And it's been a big part of our population that has been underserved for healthcare. And it's also not a one size fits all. You know, you go into a company and you get presented with a plan, and it's like, it's not a unicorn plan for everyone. It's not going to work. So I went on this mission to find a solution that I myself would want to use. And there's something called health sharing. 99% of people are not aware of what a health share is. And I do a lot of time trying to explain that instead of a premium and a deductible, you become a member of a community that shares the cost of medical needs. This is a lot different than insurance because they leverage concierge care. So you would start with a concierge team that is basically helping you navigate and route your care. So you're getting the best care at the right price. They use something called a blue book, and that is fair medical pricing. So they know the MRI, what it'll cost in Brooklyn, New York, or Chandler, Arizona. So you're being quoted the right cost, and you know what something should cost. We're so used to an insurance where you get the bill, you might end up in the ER for a sprained ankle and you'll end up with a $25,000 bill. And it's like, how did it get that expensive? So with health sharing, it's very transparent and set amounts. I know that if I need an emergency appendectomy, it's going to be a set amount of $1,000 for the entire medical need. And it's capped at $3,000 for the entire year. And this is a lot different for families that are really struggling with those high premiums and the high deductibles. This is a very fixed set amount. It's also open network. It's flexible. You can go through open enrollment literally every month. And it's also portable. We're in all 50 states. So if you have a kid in college that is outside of Arizona, it works. If you're traveling because you're freelancing for 6 weeks or you're doing business in another city, it works. And so I find health sharing is kind of a secret that no one really knows about. And Indie Pop is a company that curates high value plans. So not every health share is going to be on my site. They go through a Melissa test. It has to be simple. It has to be affordable. It has to have things that I would look for in a plan, which is no limits, annual limits for lifetime or a year cap. Some of them have health savings accounts. Some of them have unlimited primary care visits. And all of them have mental health. That's one thing I found with talking to people from across the United States. 50% of people really are seeking some kind of mental health. So health sharing is just a different alternative healthcare option to manage your medical needs. And I'll be here to answer any questions if you're not familiar with it. And that's really it. Did I go under 5 minutes?
No, you actually did, Melissa. I'm impressed. Thanks. Thank you, Melissa. Very, so far it's amazing how we're getting some different options of what's really out there. And when we all look at healthcare, it always puts us in a panic. But now we're going to have Tanika, who's has a good background in healthcare. Tanika, please introduce yourself.
Hi, my name is Tanika Smith, owner and operator of T Insures. I specialize in finding, specifically searching the government and private markets to find the best benefits for my client's buck. So whether that be private insurance, I'm very interested in what Ralph is doing. I know a lot about health shares. So if I run across someone and that's their best fit, I'm more than happy to send them that way. I want to be a one-stop shop and educator on health insurance. My background, I spent a lot of time in advertising and sponsorships and marketing, helping small businesses build their market share throughout the Valley and beyond. I've worked with Fortune 500 companies, and it's been all about engaging that business owner to build their market. Well, I took some time off and spent some time in nonprofit with the American Heart Association. And I met so many survivors of heart attacks and strokes who were broke. They lived, but they lost everything. And I started looking more into that. And I found out that 67% of the bankruptcies in the US are from medical bills. And I thought there's got to be something I can do to protect these people. A small business, 1 out of 2 small businesses fail due to a critical illness. So imagine you're running a small business and you get cancer, or your partner gets cancer, or your child, or your spouse. That can destroy the mechanics of your small business and make it impossible to grow and move forward. So my goal is, again, to search the market for you, find the best benefits for your buck. Some people prefer traditional, secure, guaranteed insurance. Some people hate regulated insurance and they want something different and special. So I think you've put together a great group here that can cover a lot of that. And our biggest issue we've had to overcome in the last 2 years, COVID. But the great thing that did happen with COVID made birth to a lot of entrepreneurs, a lot of people who lost their jobs, who don't want to go back to corporate America after being laid off, and they became entrepreneurs. And Melissa's right. When these people have this idea in mind and they go search for insurance, it can be an incredible sticker shock, especially if you're a small business owner. Even more if you're a successful small business owner, because the government is not going to do you any favors when it comes to health insurance. So that's where we all come in. I just want to make sure that everybody has access to affordable health insurance, that they don't buy into something they don't understand, that they don't buy into something that has pitfalls and lacks in coverage in places just because they didn't read the information. A lot of small businesses and new wave insurance companies are popping up because people have been failed in a lot of traditional insurance. So I'm here to be that liaison, to be an advocate, to help them find MRIs that are the best fit for them. So together, I think we can share a lot of good information here today.
Yep.
Great. Thank you, Tanika. Well, let's really dive into healthcare. I want to really get into it. And one of the things I'll kind of start with, trigger this idea, is healthcare system in America seems to be broken. And most people would agree with that statement, but what does that mean to each of us as individuals? If we're a small business owner, we're a larger business, what does that mean when you hear that statement? Healthcare system in America is broken. Give me some insights.
Well, I mean, I can speak on that a little bit. I think people get healthcare and health insurance confused. For one, it's 2 different things. Where you receive your treatment and who's helping you pay for it are 2 different things. I think healthcare is more broken than health insurance. Coding is out of control. I ask all my clients to send me their explanation of benefits so I can review them before they pay. And I swear 70% of the time, coding's wrong. And people end up paying more than what they should be. They're paying for out-of-network things that they shouldn't be. It all really starts from lack of education. Things get broken because people don't know how to use them. Things get broken when things are used improperly. And a lot of that's coming from the healthcare side, not the health insurance side. We need to educate people on how to work their way and navigate through healthcare so they can get the most out of their health insurance.
How does health insurance fit with that? I mean, they kind of go hand in hand to some degree, because let's say me as a customer, I go to my my insurer and I get these bills from the healthcare. Is there a disconnect between the two, or give me some insights?
Yeah,
Absolute disconnect.
yeah, very, very much so. And that's a big part of why we exist today. I was working in the early, about 3 years ago, trying to put together a solution with a provider, a medical doctor who had 40 years of experience. And he believed that he had a solution that he could fix healthcare. But the problem is that most people, as Tanika has said, are looking for, not most, but many people are looking for traditional solutions. A benefits manager or a relation or somebody who manages the personnel manager within a school district, for example, is almost forced by law that they have to be able to go to some kind of system that exists already. And most people mistake that healthcare, the insurance card, for healthcare, and they're two completely different things. And so what we have done at Health Track is really starting with the first point of contact that we have in I don't feel well. You hit that button and it goes to your advocate. And that advocate, again, as I mentioned before, they do three things. They have a group that helps them with the benefit optimization so that you can effectively optimize your benefits. It does wellness planning and it does medical management. So if I don't feel well and I need something immediately, you have an individual on the line that can help you, guide you either to a teledoc kind of environment, to mental health, to just getting a prescription. And then from there, if you already have a doctor, if you're one of those 20% that already has a doctor, we'll help triage your current situation and bring you to your current doctor and eliminate it. Melissa said something that's very, very important. There's a completely misuse of insurance today, and it's mostly because what Tanika's trying to solve, and that's really optimization of our benefits. So if I get sick and I just go to an emergency room, or I go to the clinic down the street that's close to me because it's part of a hospital organization, I pay the highest price and I'm not optimizing my situation. So our advocate also has the healthcare blue book to be able to identify, the best quality at the best price. And so whatever that scenario might be, we are trying to be transparent. We do have a network, okay, that we utilize, and we do serve 50 states. So we do have a network that is sometimes creates an in-network and out-of-network. However, we do also provide in our building specialized networks in various communities so that a community can make a difference in terms of being able to have specialized pricing for their environment. So that's where the disconnect is at. Most people think the health insurance card is healthcare, and they're two completely different things.
Melissa, what's your insight in this?
Well, my members are all diverse from the ages of literally 22 to 62. So I have dealt with a variety of different types of needs, and it's across the board. It's a pain point. It's a huge pain point. And there is a place for insurance. There is, but there's also a huge gap that needs to be filled where people are actually getting the medical care that they need, and they're not tied to what their insurance dictates. Just take for an example, you have an emergency appendectomy, and the doctor on call, the anesthesiologist on call that night is not in your network. And then you end up with a $1,500 bill that you have to appeal. You were knocked out. You had no idea who was going to be in network or not in network. These are things that cause frustration and stress. Or your doctor provides, look, you have a new thyroid condition. Your insurance doesn't cover medication A, so I'm going to give you medication B. And that shouldn't be the case. It should be whatever the doctor really wants to prescribe for the best course of care. But we're tied to these plans, these networks, and Tanika's right, with these coding, it is a nightmare. I had one person that came to Indy Pop. She had surgery last year. Her eye was coded not as an emergency. She's out $45,000. She tried to fight it. I mean, Tanika has stories like this too. We all have heard nightmare stories. It is broken, and it needs help. And it starts with I don't want to be an ID card. I want to be a patient, like what Ralph is doing and what Indie Pop is doing. We leverage concierge care. We have a team that is there to help support you and mitigate all those midnight runs to the ER because you have pink eye or a UTI or a strep throat and you can't get into your doctor. And we try to get the cost to $0. So there's two schools of thought to look at and what you want from your healthcare and what actually then with insurance, what's working and what's not working. Because we're just so used to insurance. That's it. It's been around. We're not using any other way of doing it, anything, different for our health.
And because we are an insurance company and the doc who was my mentor, he'd say, oh, they're just another insurance company. Well, I believe that from my perspective, to be able to solve the problem of insurance, you've got to be on the inside. Can't do it from the outside. So that's where I created our own captive insurance company, which is very different from traditional insurance companies. And I think what we're talking about historically, the insurance companies that control the market today are what's commonly called the BUCAs, the Blue Cross, Blue Shield, United, et cetera. And Kaiser did a study over a 15-year period where they found that healthcare insurance has gone up over 200% during that period of time. Our individual contribution to that insurance went up over 220%, while our individual income went up only 57%. And unfortunately, what's happened, we now find ourselves that medical errors is the third leading cause of death in the United States. And to Tanika's point, the largest percentage of bankruptcies in the United States are because of medical expenses. So it's gone the wrong way. And the traditional insurance companies are still, I know they want to help protect your individual situation. However, we've seen it go just the opposite direction. So we are coming into the market. We are a captive insurance company. We do provide much greater control over how you want to pay those claims, et cetera. We increase the stability of the rates, and we improve the transparency of how you utilize healthcare. So we're focused in a very different way than traditional insurance companies, but we are on the inside trying to change how insurance is utilized in America.
Hey, Jeffrey, if I can, let me take a little different spin. So I'm Harry Gerwell. I'm new to the chamber here. So I have, my company is a consulting company, and right now we're in the healthcare space as well as some other spaces. But I want to take a little different perspective, because what we're talking about is how the insurance payers pay out, how they dictate CPP codes, how they end up, really driving it. So my experience is that I owned a medical family practice in medically underserved areas in Phoenix. And my background was never in healthcare. Actually, my background is aerospace defense contracting, nonprofit, economic development, for the city of Phoenix. So I have a pretty diverse background. But in 2009, I got involved with healthcare because I helped a friend get started with one of the first physician assistant-owned clinics in the state of Arizona under the Affordable Care Act. And we took full advantage of the ACA. So what I mean by that, I was able to get all of my hardware, all of my software, all of my training from my medical providers. And believe me, I didn't put on latex gloves. I was the business guy on the backside, right? And took advantage of all those things. And what we discovered was that the insurance companies were charging enormous amounts because they had to offset their costs of frequent flyers that were going through the ER. So we put together a model program, and in 2011, we put the first integrated healthcare model where we provided primary care to 25 severely mentally ill patients. And as a result of that, we were able to save United Healthcare in 6 months over $4 million. And then Access, we were able to save them over $4 million. And they came and told me about that before I even realized what we were doing. And so as a result of that, I thought when they first called me, they were going to come in and want to renegotiate my contracts, right? I thought they were going to drive it down. After they told me that, they go, what do you think, Aaron? I said, well, I think we ought to renegotiate my contracts. Start coding me at a 5. I need CPP codes to do education in the patient room. I need to be able to do smoking cessation so we can get people off with tobacco, chronic illnesses, and what have you. In 2012, I actually sold my clinic back to my former business partner. So that's what launched me into this healthcare. So what I learned from that was how do you take advantage of the insurance payers, but also provide quality healthcare. And so today we've got a number of different products and services. One in particular is that we've developed a scalable digital platform that we offer as a price point to other markets that they typically don't have access to. So what does that mean? That means that we're able to get the provider, the actual physician that's providing the services, an increased amount of coding so that they can get paid higher without passing that cost on to the patients. And the way we do that is that we provide the patients with all of the different devices they need at no cost upfront. And we provide that information to their provider through a remote patient monitoring system that we put together. We're in 7 states today. We're opening up the Arizona market. And what that does, it allows insurance companies to realize savings. So they love us because we're really saving them money on the backside. Our providers love it because they're actually making more on each one of their CPP codes. And our patients love it because they can monitor their chronic illnesses without having to go into the physician's office every day. You know, they got the blood pressure cuffs, they got the digital scales, they have all those monitoring devices. So from a different perspective, and Ralph, you mentioned this, Kaiser actually initiated this whole debacle, what I call debacle, in the 1970s when they went to the HMO because they separated integrated healthcare from primary care. And now we're coming full circle, right?
Yep.
But Kaiser has always been the one that's dictated how these things work. So from a practitioner's point of view, I had to figure out how do I overcome these issues? And the way we do that is by demonstrating the cost savings to the insurance companies who will in turn, incentivize our providers to continue doing that by paying them more for their CPP codes. So there's a different perspective here, right? Which also moves into the hospitalists when you start to think about, the ERs and what have you. So I'm really glad, Jeffrey, that we're having this discussion because whether it's, what Melissa's doing or what Ralph's doing or Tanika's doing, I think there's an opportunity for us to all get together and do one thing, provide high quality healthcare and coverage for our members. Oh, by the way, I should mention, I used to run the Minority Business Enterprise Center for the U.S. Department of Commerce through the Arizona Hispanic Chamber. And so I do understand how small businesses get impacted on the healthcare side as well. All right. So anyway, I'm looking forward to continuing our conversation here and learning more about what everybody's doing.
Thank you, Harry. That's great insights. And any other perspectives on healthcare today? Speakers.
I think I would just make one general comment. I believe that everybody that's spoken here today has some very significant positive contribution to addressing the healthcare issues. And I believe that since day one. And I think that there's a need for what we're all doing and there's an opportunity. And in my whole strategy around creating our own captive insurance company, our own technology and our own advocacy is to be able to build an ecosystem that takes advantage of the specialty care and services that are provided by other people in the industry. So we have a national transparent pharmaceutical company. We have mental health, we have telehealth. So if there's other services that make sense to become part of what I would call our captive insurance that's owned by us and the employers, and those claims dollars belong to them, not to us as an insurance company, is to build that ecosystem to take advantage of the benefits that are now being created in the market that are really making a difference. And hopefully we can utilize our platform to try to bring some of these together to make a difference. And again, people say, how can you talk about reducing costs up to 40% over time and while providing better healthcare? Well, you've heard today, there's many examples of how that can be done very effectively by people that are very professional at what they do and have done it for a period of time. They just go unknown.
How do you get the most out of health coverage today? I mean, it's a challenge all the way around.
Knowing your policy. So many people for so long, especially if you've had the privilege of having access to group insurance through an employer most of your life. I've been called into many of those mandatory insurance meetings, and all you care about is how much are you taking out of my check? Maybe what's my deductible? That's the only two questions most employees ask. So then when they go to use their insurance and they don't use it properly, then they're upset and that the insurance company has failed them. So my advice, even if you buy group insurance from your employer, call an advocate, call someone like me, an analyst, anyone to review your plan so you know what you've actually invested in. I believe the number one complaints for insurance companies come from people using their insurance incorrectly or don't have the knowledge of the benefits and pitfalls of their coverage. I use a lot of concierge services myself. I think there should be variety, but I serve the community that wants to be able to go to any hospital, any doctor that they want at any time. They don't have to go through anybody for that decision, especially if, like Melissa said, if they're traveling. I want them to feel comfortable picking up the phone or walking to anyone's office and knowing they're covered. I think that's just asking questions and knowing what you've purchased is huge.
I'm going to chime in because there's a lot of websites people can go to. I mean, technology has taken over healthcare where you can literally go online and enroll. Many times you got to be very careful with how things are worded. If you see something 100% pay, is it you pay or the insurance company pays?
Right.
And that's a big difference. And so it really is reading that fine print. I wanted to get back to something that has changed, just to give some insight on millennials and how they approach healthcare. If you're interested, is they love telehealth and they love anything with technology, and they don't really want to take time to drive and go see a doctor. So this anything that's alternative, that I said, yeah, you could get your prescription filled literally using the app. They're like raising their hand like, oh, that's so great. Whereas you talk to someone over 40 and they're like, what do you mean I have to use technology, or I have to call this number before booking an appointment? So you could see it's a shift in thinking too, how we're moving in healthcare. There's a lot more wearables and a lot more technology that doctors are using. My mom uses the Libra for her type 2 diabetes. This goes to her smart app so it can monitor her glucose levels. I mean, she doesn't have to prick her finger anymore. It's amazing how far we're coming, but there's all this data. And what I'm finding is younger people really like that proactive feeling and the management of their time in a different way than a copay and a deductible. They like having additional services.
Yes, if you're not offering telemedicine, you're not in this time zone. So telemedicine has to be a partner with every health plan. It's huge. And then what you were saying earlier, Melissa, I believe about not about coding, but just people want different options. Maybe I'm okay seeing my general practitioner telemedicine, but my allergist not so much. And so being able to have those options are huge.
Absolutely. Flexibility. You don't want to be pigeonholed into these small little networks.
On the other end of that spectrum of millennials, right? And by the way, I'm one of those people that uses my app all the time. I log in, I look at my history, I make my appointments with my physician and all that. But in the devices that we are able to give to our clients, most of them are seniors because we typically deal in Medicare and Medicaid. And Arizona is one of the only states that pays telehealth for both Medicaid and Medicare. And so with the Medicare side, a lot of our seniors, we give them the devices. If, let's say, their blood sugar is going up and they're taking their readings, that automatically goes to the provider. The provider has already got it flagged if it hits a higher level, and they automatically call, their patients up and say, hey, what's going on? I see your glucose is up. And the patient doesn't even have to go into the office. So we're finding a lot of the patients of our providers are really happy with that, especially the older ones, because they're like, well, I wasn't feeling too good. And the provider already knows that the glucose is up. So then they give them, some remedies, right, to be able to do that from their home. So there's a lot of benefits to telehealth. And I think the pandemic really, really demonstrated that for us, because how many times did we want to go in to see the doctor? during the peak of the pandemic. I didn't go, I'll tell you that. That's
Well,
why I got online.
they don't want you in the waiting rooms if you're exhibiting any kind of fever or sore throat at this point. So there has to be another alternative.
Absolutely. And Tanika, to your point, some of the advocates, so let me share this with you since we're talking to the seniors. The Area Agency on Aging has great medical or Medicaid advocates who will sit down and go through that process for those seniors who are confused by all of the rhetoric that's going on, right? And get them onto the best plans that they can possibly do. So I think there's advocates throughout the spectrum, whether it's millennials all the way up to seniors. And to your point, Ralph, how do we grow that ecosystem so that everybody understands where are all these resources? How do we get in touch with them? And I find like in our communities, right? I live in a low socioeconomic community in downtown Phoenix, and we're still trying to get them to understand that healthcare isn't something that they should be afraid of and that they can afford. And we do that through education, by helping them to understand how to access it, whether remotely or going in, or I'll say this, even my clinic that I had as a medically underserved area, we provided 20% of our patients uncompensated care. And the way we were able to do that is that we got higher CTP codes from our insurance payers so we could offset that. So there's a real benefit, business case to be made to the insurance providers as well. But I love your comment about millennials. My daughter's a millennial and she won't do anything except, Dad, here's my app. What's the name of that doctor? And let's go do it, right? Whether it's dental, vision, medical. I haven't seen her go into a medical facility in probably 4 or 5 years.
What's
Yeah,
the
I did
best way
some
to
research.
really locate an insurance company? What can we do in that respect? What are some of the options to locate or identify an insurance provider that we want to use?
Not online. That's the worst place you can go,
Is that
in my opinion,
Right.
is online. As someone, when I started in insurance, that, I could show you call centers that they're nothing but people doing this all day, blowing your phones up. A lot of the online sites are nothing but fronts for telemarketing companies, and they take your information and they sell it in a matter of seconds, and you stay on those lists for upwards of 2 years. So I warn anybody, if it's health insurance, car insurance, mortgage, life insurance, no matter what it is, if it's a website that's saying you can go and get multiple quotes from different companies, it's typically complete fraud, and they're selling your information to telemarketers. So
Well,
go to a
that's
consultant.
interesting?
Yeah,
Yes,
the
Melissa.
competition that I face are, and I'll name them. It's like Oscar Health, Stride Health, Catch.co, and they promote saying that they have affordable discounted insurance, and they then curate all those different insurance, Ambetter, Bright Health, Cigna, all into one pool. And you're going to get your metal plans, your bronze, your silver, your gold. It's all the same. And there's nothing wrong with going through these types of services. It's just, as Tanika says, you've got to read the fine print and not find out later that your medication is tier 3 and it's not going to be covered. Like, you just have to know ahead of time. And people they don't take the time to actually read line by line. They see, oh, $0 monthly and my deductible is $3,000. Okay. But they don't know what's in their plan. And that's a big deal. At IndiePop, we don't go through, and I'm sure you've all had the telephone call. Is this for your family or individual? Are you a tobacco user? And it's just like an interview question. It's very cold, and they really care about you and what your family needs are. So that's something that at IndiePop, we have actual conversations and people that match you, if it's even a right fit for you, because not everyone's going to fit into a health share. So I just wanted to bring that up.
And to
Jeffrey,
double down
one other option also is, small insurance brokers. For example, because I have my own company, I need a general liability insurance. So my broker out of Mesa got me the best deal, right? But then I was talking with him one day and I said, man, my insurance just went up that I was buying for my own, company use, for my own personal use. And so he went out on the market and found me a great, plan. And I said, oh, by the way, do you have prescriptions? So he sent me those as well. And then I said, well, what about vision? So, you can look at the small, locally owned insurance brokers who are independent, from the big conglomerates, because really, they serve two purposes. They have access to all these types of plans, but most of the time they're also financial planners. So they're always looking out, and the fiduciaries. So I find that, if you find somebody that's a fiduciary, they're going to do whatever is the best interest for you, not for them. Because insurance,
100%. And I'd also like to double down on the lingo, swing back to that, Melissa, and what you said about educating is because, like she said, the different plans use different lingo on purpose. They do that to confuse, and so you can't compare apples to apples. It makes it nearly impossible to compare apples to apples with the wording. Someone will say, yes, it's 100%, but there's still a maximum payout. So it's confusing. Yeah, we're going to pay $5,000 up to $5,000 and the rest is on you. So that lingo is very, very tricky, and it's tricky for a reason. So have someone look it over for you. That's a great suggestion.
So let me just make a comment as the only different insurance company that's on the call right now. And our advocates understand exactly what when you dial in, I don't hit feel well, or I want to know more about my policy or what it covers. You're talking to somebody who already has your medical record, has the ability to evaluate your situation and to go to immediate next step that's appropriate for you. The second thing is that we talked about data. We're a technology company. I think that data is probably going to be in the future one of the most important things we can utilize to really provide consumerism and to use that data to get back to the individual so that they can make better decisions on their health. That's guided. The other premise I think that we have that we're all talking about, healthcare is complex. So each one of us are trying to solve various aspects of that complexity. And the other side of it is very personal. So when you have an issue, it is very important. It's between you and that provider, whether it's telehealth provider or whether it's the person you go into the office. That is the beginning of your well-being in healthcare. So all of those need to be part of a solution, and we all bring parts of that to the table. But I would contend that traditional insurance is what we're all trying to change and get away from and or utilize differently. And I would also second the comments about the utilization of the broker. 95% or greater of all small businesses buy their healthcare through brokers. And so we utilize brokers to go to market as well, but not just any broker. We don't want to utilize the brokers that's selling the bukas and getting the back end payments that they're getting significant coverage over. They're motivated by the dollar that they're getting from the large carriers. We want somebody who's truly interested in understanding our solution and understanding how it makes a difference to the employer and to their employees and families. So I think there's a lot of similarities and objectives that we're trying to solve. There's different ways to get there. And each of us, I can't go down to 2 employees. I can't do the individual, but we are a technology-based organization, a healthcare insurance company that's doing things differently and going through a sales environment to the market through a whole different way to approach the distribution side of insurance.
And just to, because I know, Ralph, we also we don't call it advocates, but we call it concierge service or care logistics. So there's many names for it. So IndyPop, all of the healthcare plans start with basically a team that's helping you guide and navigate your care. And I think that's where healthcare is moving forward. Also, where I see healthcare moving into is direct primary care, where you're on a subscription plan monthly to see your doctor, unlimited, whatever it is, virtual visits. People want more care. They don't want to be an ID card anymore. They want to feel like they're being taken care of and they're getting the best route of care.
And I agree, Melissa. The word advocacy is being used a lot, concierge.
Overused.
Again, overuse. What people don't know, whether you're going with traditional insurance or not, all those services are available. If you come through me, I'm your advocate. I have a wonderful assistant that is there from the moment you sign up. And you can call. I'm available to my clients 24/7. I get 2:00 in the morning phone calls, and I'm the same one that signed them up and their kids. I know their kids' names because I like that personal engagement approach. If they didn't want to use me, whether you're with Blue Cross Blue Shield or all these, they all have advocacy teams. They come into your workplace. They tell you to call them. They tell you they'll give you free nutrition, free this. no one takes advantage of it. I had Cigna and Aetna for years, and they offered all of that stuff. They will come to your work. They will do tests. You get all of it for free. We had a free clinic on site at work, and people don't use it because they don't understand. They don't they don't take advantage of the things that are offered to them, which is how a lot of smaller companies are able to pop up and say, we have advocates, we have this, and it appears to be different. But I guarantee you, all of those same things are at bigger companies. They may be a little harder to get to because it's not what they're using in their main promotion, but they're there. So if people would read, do their research, go on their website, open their portal and sign up for their portal when they're supposed to, they would have all this information.
Okay, great. Let me ask you, I've been dying to ask this question. What is the problem that each one of you solve? Because there's a lot of challenges out there.
One of the main problems I solve is to keep people from going online and picking insurance that just fits their budget or that's cheap. I hate it when people call me to say, I want the cheapest plan possible. So then when you need the plan, you don't want them to pay very much. Is that what you're asking? So you want the best benefits for your budget. So, you know, my budget may be $800 a month and I want all these perks and supplements, but someone with a budget of $300 a month may end up being a completely different ballgame. So I feel like what I can fix, what I can help with is helping people make the right choice, regardless if I get paid for it or not. Those are the best referral people. The people you help, people you put compassion before compensation are your best clients. And they come back to you over and over again. So I think education, that's what I could do to fix it.
Okay, Melissa.
Tanika and I are on the same page there, because we actually have told people, you know, we think you should stay with traditional insurance or actually go on like the access plan. They might qualify. I think doing the right thing is what makes companies stand out, because you're absolutely right. People will refer and go, she just didn't sign me up to sign me up. But what IndyPop solves for is transparency, and you know what your medical cost is going to be if something does happen to you. I think that is the greatest thing that I have found with a health share and that open network. So if there is an emergency, you know exactly it's going to be $1,000 for that medical need, any doctor, any hospital, and the flexibility that it can be used, you know, anywhere in the US, that it's in each state. I don't have to look at it and go, what are the insurance laws in Colorado compared to Arizona? It's the same. And that two out of three of my plans there's no age band. So $275 a month for a 26-year-old or a 56-year-old that's pretty amazing at age 56 to get a plan under $500. So, and not talking about subsidies or anything. We're just talking about, you know, straight up plans. So those are some of the things, some of the highlights and why I'm on my own plan. So,
Ralph.
So from my perspective, there's three things that we're trying to solve. Number one is we want to lower the small to medium-sized business employer and government agencies. We want to save them up to 40% on their insurance costs. And for their employees and their families, we want to be able to deliver them far better health care at the best price in the marketplace. And third, as a company, we want to be able to give back to the communities that we serve. And all the things we're talking about and all the different aspects of what we do, whether it's through advocacy, data, technology, transparency tools, et cetera, all that leads to trying to drive the cost down, deliver better healthcare, and be able to give back to the communities.
Great. Let me ask you this. It sounds like all of you have a background that really didn't start out in healthcare. And I kind of know the background of all of you. So why are you in healthcare now?
my own personal pain point. Seriously, I felt the pain so much. And I knew so many different independent contractors out there or solopreneurs that I said, what is everyone doing? 43% either pay 3 times the rates or they go without healthcare. And I said, we're in the United States. Like, why is this tied to a company to get our healthcare? This is just ridiculous. So there's got to be a solution out there. So this is a solution that's really not mainstream, but it is an alternative out there.
And how long have you been in existence?
2 years.
2 years. Okay. Okay.
I'm in healthcare because one thing we always hear is about generational wealth and how that can impact a family in passing that wealth and that education of how to gain and maintain wealth down to your family. Well, I want to create generational health. And I think if you have good health care, whether it be through group or private, that's something you tend to pass down to your children. They have come accustomed to good health care. And if you're passing down generational health, you're going to have typically live longer, have more successful children and bigger families and healthier families. It makes such a big impact because I've seen what having no insurance or living your whole life on government insurance, how that can impact a family. So I want to throw a curveball, not just in how we approach healthcare, but what we gain from healthcare in the long term.
Great. Thank you, Tanika.
Yeah, I have two perspectives, and they're both pretty simple. One is healthcare is broken. As a business guy, that represents a big problem and a major opportunity to solve. And this is a big issue, probably the biggest our country faces today. The second thing is, on a personal basis, I lost my mother because of a lot of the reasons that we have here in terms of the medical errors, the complexity, the wrong medications, et cetera, et cetera. For her case, it wasn't cost, but it was misutilization of the healthcare system. And I lost her through that process. So I had a personal motivation to figure out what was going on. And then as I discovered that, this is what we encounter today. So I spent over 3.5 years trying to figure out how to make a difference, and was able to fortunately put together a group of people and a team that's very strong and experienced to help make that difference. And I'm very pleased to see people like Melissa and Tanika and others who are trying to do the same thing, because we represent that probably 10 to 15% of the market solution that's different from the big insurance companies. And we will start to make a difference and make an evolution of healthcare, in this marketplace and in this country.
And Jeffrey, for me, kind of a different perspective, right? And owning my own clinics, what I saw was the propensity for a higher number of chronic disease within our communities. I'm in a predominantly Hispanic, African-American community. So I saw that propensity, and what we found was that once we were able to help them to increase, the monitoring for the chronic illnesses, significantly improve their individual quality of life. But on the other side of it, as being a provider, we are always struggling to get that next, CPP code so that we could continue to provide that service as a doctor's office, right? And what I found was in utilizing this technology, not only did we improve the quality of health for our patients, it generates revenue for small practices, medical practices, so that they can continue to be in our neighborhoods. That's the reason you don't find high quality healthcare in underserved communities, because they can't afford to be in there unless you're an FQHC, a federally qualified healthcare center. But private entities, private primary care practices, they really care about their patients. So by utilizing technology, what we've been able to do is to help them generate additional revenue. And I'll give you an example. One of our patient clients using our technology are realizing a $50,000 a month increase in revenue by utilizing our technology, because we can charge the CPP codes, 5 of them that we have, that went from paying $40 per visit to $120 a visit. And our provider, our doctors didn't have to do anything other than to utilize the technology, because we took care of, how did we find out which was the right CPP code for them to be able to generate revenue. And more importantly, the patients are doing a lot better because they're using medical devices to be able to manage their chronic illnesses.
Great. Thank you, Harry. We got about 5 minutes left, panel. Let's kind of give a final overview, last comments, happy Thanksgiving wishes, whatever that is. We got some time.
I think there's a lot of good options out here. And if anyone doesn't have healthcare, please talk to one of us, because as Tanika mentioned, I mean, medical debt it's real, and there are a lot of options out there. So I think all of us really care about making sure that people get the right healthcare, the right benefits, and that you're not overpaying either, that you're finding a match to what your needs are. And happy Thanksgiving.
Thank you.
And happy Hanukkah, which is 3 days later after that.
Ralph, you want to go?
Yeah, I just think that I just want to say thanks for being a part of the panel, because I think it's a learning experience every time I hear from others, and it's always great news to figure out all the possibilities to make a difference. And I believe that we have a platform that has the ability to integrate a lot of that. And people like Tanika, who represents, in my view, kind of the broker community. You know, you're exactly the kind of broker that this market needs, and the kind of individual we need to be able to support our products. And Harry, I'm going to like to learn more about your products. And Melissa, you cover a whole group of people that I just don't have the ability to address at this point in time. So, you know, I think that's very, very critical. And so I'm glad to be a part of it. I think we can collaborate and help each other. And most important, our patients should be the biggest benefactors from what we're doing. So happy Thanksgiving. I'm enjoying my family that's coming from different parts of the country to Colorado. So I'm looking forward to it.
Tanika?
Yeah, thank you, everybody. I actually learned a lot, and I think that's always a good day when you learn more than you woke up this morning. I don't know if I'm the only licensed insurance agent on the call, and that doesn't always make a difference. Melissa, you're licensed as well. I'm licensed in 28 states, so I am not afraid to travel to a state to meet with a small business. I have advocates that I'm building in every state. I have a wonderful team of Medicare, ACA specialists who with just simply a hand or a text, I can transfer that information to someone who's going to find the best benefits for that person's budget. So I want to be that one-stop shop. Now I have a great referral partner in Health Shares, which I understand and know a lot more about. So just one, be an adult, have health insurance. That's at the end of the day, that's what's most important. But make sure you're knowledgeable on what you buy. And there are plenty of people out there that will keep you informed and let you know the pitfalls and the benefits in your plan for free. So take advantage of that, and together then we can change the industry. I'm confident of that.
If you wouldn't mind just typing your emails in that, in our notes, if anybody wants. But also keep in mind, everybody on this call, you could just reach out to the chamber regarding information on our 3 speakers here today. And I just want to commend you, the 3 of you, for your passion and your commitment to helping businesses get some quality insurance, and also being a resource for them, not just after they buy it, but you're always there. So thank you for being part of this today. We really appreciate everything you do. And from me and the staff here at the Southwest Valley Chamber, we want to wish you all a happy Thanksgiving. Be safe, eat a lot, and we'll see you at the next one. So thank you very much.
Thanks, Jeff.
Yeah, everybody.
Thanks, everyone.
Thank you.
Eat healthy.
Oh, by the way, fun fact, more ER visits from people literally overeating because they go crazy on Thanksgiving and they're not used to eating 4,000 calories. They end up in the ER. Also, cutting knives and slip and falls. Those are the top holiday accidents. Yeah.
So you just got me depressed now.
You can still eat, but like, know that you don't have, like, it's not your last meal, Jeff.
Okay, all right. Thank you all.
Okay.
Have a great rest of the day.
Thank you.
Bye, everyone.
Bye.